Professor Stefan Seewald from Switzerland, who's going to give us a talk entitled Join a New Wave of EUS, Introducing a Novel Ultrasound System for HPB. Stefan.
Thank you very much for the invitation to this meeting. It's a great honor for me to be here, and I'm very happy to discuss with you our experience with the brand new Olympus Canon Endoscopic Ultrasound System. And as you can see here from these pictures, endoscopic ultrasound is not anymore only black and white. There are a lot of colors, but what is most important, there are a lot of new features and functions. And the idea behind this cooperation between Canon and Olympus is to bring the technology of Canon, the ultrasound technology of Canon, which is amazing, into the endoscopic area. So it is now endoscopically available, and this opens up new dimensions for endoscopic ultrasound. Let me go through with you about some important features of this new system. So one feature is differential tissue harmonic imaging. Compared to tissue harmonic imaging, this is a Canon technology based on a dual frequency approach. And this technology enables a deeper and better penetration while maintaining the good resolution in the near field. Second, there is a new Doppler, the superb Micro Vascular imaging. This is a Doppler showing you and visualizing small vessels with low flow and without motion artifacts. For sure, in this new system, there's also contrast-enhanced EUS available with high resolution, but you can also quantify your measurement with the time curve analysis. Another new feature is the 2D shear wave elastrography from Canon, which is now also available endoscopically. And compared to the one-point shear wave elastrography with this 2D approach, you have a plane of shear wave which enables a more accurate elastrography. There's another feature, the attenuation imaging. This is a feature for the diagnosis of fatty liver disease. This feature is so far not available endoscopically so far in Europe. But last but not least, we have the Panoramic View and the Smart 3D function, which generates 3D images and displays these images. Because some clinical cases will tell you more than 1,000 words, I have prepared some cases for you to demonstrate these new features. This is a 70-year-old female, and this female has a 2.5 centimeter lesion in the pancreatic head. This is the computer tomography. And we performed an endoscopic ultrasound in this patient, and I would like to demonstrate you the features of dTHI, SMI, and the contrast-enhanced harmonic EUS. As you can see here now, this is the 2.5 centimeter lesion in the pancreatic head. And you may notice already this feature of dTHI. We have a perfect resolution in the far field and an excellent contrast in the near field. And this lesion is echo-rich. It's about 2.5 centimeters large. And now I'm using the classical Doppler function, and you can nicely appreciate here there are a lot of vessels around the tumor and also in the margin of the tumor. Now I'm going to switch to the new Doppler SMI, and you will notice now with this Doppler we can appreciate a lot of small vessels in the center of this lesion with low flow. So it appears that this lesion somehow consists only of vessels, and after using SMI we performed a contrast-enhanced harmonic EUS in this case, which I will show you now. So we injected 1 ampule SonoVue, and after 10 seconds we had a really impressive hyper-enhancement. So first we suspected that this could be a neuroendocrine tumor, but there was no washout after 25 seconds, and even after 1 minute 10, there was still an hyper-enhancement. So as I mentioned before, it appears that this lesion only consists of vessels, and this is the rare diagnosis of a pancreatic arteriovenous malformation. Let me come back to the superb microvascular imaging, SMI. There are two features. We have color SMI and monochrome SMI. This is an example of a patient with a 3 centimeter cystic lesion in the pancreatic head. And now we are using SMI, and you may appreciate in the septa there are small vessels with low flow, and now this is the color SMI, so the B mode is extracted, and in this case you have a higher sensitivity for the Doppler, so we can better appreciate the smaller vessels. And another advantage is also, with this filter, you can not only see the small vessels and this low flow, but also the larger vessels with a high flow. And this is an important novelty compared to other filters. Let me come now to a second case. This is a 60-year-old female, and she has a 7 by 5 millimeter lesion in the pancreatic head. And I would like to demonstrate dTHI, SMI, contrast-enhanced harmonic EUS with quantification of the measurement, and also the new 2D shear wave elastrography. So here you can appreciate this small lesion, only 7 millimeters, and you may see again there is an excellent resolution in the far field with very good contrast in the near field as well. This lesion is only 7 millimeter, and now again we are using SMI, and here you may appreciate this small tumor has small vessels with low flow, so this is very suspicious for a potential neuroendocrine tumor. And now we are also performing contrast-enhanced harmonic EUS, and after injection of 1 ampule SonoVue, you may see that after 10 to 15 seconds, we will have an impressive hyper-enhancement of this lesion. And what you can do now, you can quantify these measurements with this time curve analysis. And this nicely shows you that you have an hyper-enhancement after 15 to 20 seconds, and then you have a relatively quick outflow of this contrast medium. So this is very typical for a neuroendocrine tumor. So you are able to perform a post-procedure analysis, and what you can also do, you can compare different areas with regard to the hyper-enhancement of this pancreas. Let me come now to the 2D shear wave elastrography, and please focus first on the right picture. There is now a new system which enables a more accurate measurement of the shear waves. And this is the so-called propagation map, and this propagation map shows the shear waves as wave fronts. So you can see here these waves, and as long as these waves are smooth and are parallel in line, then you have an accurate measurement. On the left side, you see the elastography, and we have in our system a low elasticity is blue and a high elasticity is red. So you may appreciate here this neuroendocrine tumor, which is harder. And we can also measure now the elasticity modulus, and we can compare it to other areas. So here you may appreciate this tumor here in the center is harder than the surrounding. In this case, we performed an EUS-FNA, and as you know, it is quite difficult to get material from these lesions, but also due to this dTHI, we have a good resolution in the far field, and we were able to diagnose here this neuroendocrine tumor with a low proliferation rate, so we put this patient into our follow-up. Let me come now to a last case. This is a 77-year-old male with painless jaundice with a weight loss, and in the MRCP we can only see a dilated biliary system. The pancreatic duct is okay, and in the MRI there was a discussion if there is maybe a papillary tumor, so we performed a duodenoscopy, but the papilla looked quite normal. And then we used endoscopic ultrasound with a new system. I would like to show you dTHI, contrast harmonic EUS, and the smart 3D function. So here you may appreciate the dilated bile duct. I'm talking now the endoscope into the direction of the papilla, and there appears something within the bile duct. Now I'm almost at the end. In the duodenum now, I'm talking back the endoscope. This is the pancreatic duct, but you may nicely appreciate there's something in the bile duct. So this is now the longitudinal axis of the bile duct, and you see here on the left side this lesion. First, we were hoping a little bit that this is maybe a stone, but contrast-enhanced EUS very clearly showed that there is also an enhancement after 10 minutes. So this is supposed to be a tumor. And now we have used the 3D smart function. So this function calculates and displays 3D images, as you can see here. So we can choose an axis, and then we can look into the bile duct, and we can also talk our image. So we have a lot of possibilities to have a look here at this bile duct with this tumor in the distal part. And as you can see here, we can also talk. So this is the system where we look into the bile duct. And when we talk it back to the left side, you may appreciate the wall of the bile duct and the tumor. So there's another system where you can have a reversed representation of this image, where ducts which are filled with fluid are shown as tubes. So what I want to say, this system is ahead of his time, and I think there are a lot of possibilities. We have to check in the future what we can all do with this system. So in this case, we performed an ERCP with biopsy and stent placement, and the biopsy showed already a intraductal papillary neoplasia of the bile duct, and already in the biopsy, a lymphatic vessel infiltration could be diagnosed. So this patient underwent a Whipple procedure, and this is the operative specimen. Here you may see the distal bile duct, and within the wall of the bile duct there was the tumor which obstructed the CBD. Let me conclude. The advanced technology in this Aplio i800 EUS system, with its innovative function and features, improves the diagnostic precision and efficiency in the daily clinical practice, and this allows us to provide the highest standard of care for our patients. And at the end of my presentation, I would like to draw your attention on our EndoSwiss meeting on the 27th and 28th of June in Zurich. EUS will also be a hot topic, especially in our EndoSwiss Innovation Forum, and two pioneers of EUS, Pietro Fusaroli and Kenneth Chung from the United States, they will discuss new topics in EUS. Thank you very much.
We've probably got time for one question.
Yeah, great presentation, very convincing, Stefan. At the end, it was really the future. So coming back to the Doppler and to the harmonic in SonoVue, the clinical relevance is probably associated with the fact that you decide not to do eventually the biopsy, or you decide where to do the biopsy. So how does it impact your clinical practice? So this is the first question.
Yes. So the impact, I think in the future, I think we don't need the contrast-enhanced harmonic EUS in every case. When we have studies demonstrating that this SMI Doppler is enough, I think this is okay. But for sure, we need somehow a histology, or better to say, a trial to get an FNA, because this is then better for the follow-up of the patient and also for the discussion with the surgeons and in the tumor board, etc. But I think there's also a discussion, do we really need this? I think in France and Japan, the contrast-enhanced harmonic EUS is widely used. My position is we have a lot of subepithelial lesions in the stomach. And there's the question what we should do. And I think a proper EUS examination with this filter would be quite good, because we can select these patients for a potential resection, but for sure we need more studies on that.
Second question, Stefan. If I were an oncologist, okay, and I give chemotherapy to one of my patients, I have to be interested in the reduction of the volume of the lesion, because this is what you can have from CT or PET. Do you think that with this 3D approach, we can, for instance, measure the response to chemotherapy of a pancreatic cancer, or any type of cancer? Do you think that we can move from measuring the diameter to measuring the volume in the next future?
Yes. I think this is a very good question. I think yes, but we need to perform the EUS examination more properly, because nowadays it's mostly do the FNA and then finish. So we have to perform a post-procedure analysis. This takes more time, but I think there's a great potential to do that.
Thanks. Great. Stefan, great presentation. Thank you so much.